Breast cancer. It's one of the scariest phrases you'll ever hear. What's even scarier is 1 out of 8 women will develop breast cancer in her lifetime. In chemotherapy, a cancer patient is focused on getting healthy, preparing to lose their hair, lashes, and brows. But most people are confident they'll grow back, until they don't. If you are among the millions of breast cancer patients treated with Taxotere each year, there's a chance your hair won't ever grow back. Depending on your age, you may be wearing wigs for the next 20, 30, 40, or more years of your life. The worst part is, it's totally preventable. Taxotere, also known as docetaxel, is the most commonly prescribed chemo treatment for breast cancer. But the little-known side effect of permanent alopecia is rarely discussed. Up to 75% of breast cancer patients will receive Taxotere as part of their chemo treatment. 6 to 15% of those patients will experience permanent hair loss, never growing back their hair long after treatment is completed and successful. In the fight against cancer, it seems like a small price to pay, until you consider that Taxol, the alternative that Taxotere is trying to replace, may be just as effective in treating breast cancer, minus the risk of hair loss. In 1996, the United States Federal Drug Administration approved Taxotere for breast cancer treatment and usage begins. In 2005, permanent alopecia was warned as a possible side effect in the European Union. In 2012, permanent alopecia was warned as a possible side effect in Canada. In 2015, permanent alopecia was warned as a possible side effect in the United States. In 2016, the first lawsuit is filed against Taxotere's maker Sanofi Aventis. This is a blatant injustice. Drug manufacturers are required by law to tell consumers of the potential side effects associated with their drugs. With Taxotere, patients face the risk of permanent alopecia. Sanofi Aventis warned European consumers of this side effect long before telling those in the United States. Sanofi Aventis waited 10 years before sharing this side effect. Although the manufacturer is now warning of this side effect, it's buried at the end of a lengthy label. Very few doctors, nurses, and medical professionals are aware of the warning. Because the hair follicles are dead, not dormant, products and treatments will not grow the hair back in an affected patient's lifetime. This can be devastating news. This isn't just about hair. It's about having the right to make informed decisions about your health care. Surviving cancer is a triumph. You deserve to be among the women that survive cancer and look as healthy as they feel. The permanence of hair loss can impact more than just your hair. Studies show that women with permanent alopecia after cancer can suffer from the following: anxiety, depression, lowered self-esteem, poor body image, lower quality of life. If you don't have hair growth return in 6 months after finishing your chemotherapy, you may have permanent alopecia. If you haven't experienced regrowth yet, you may be among those permanently affected, but time is of the essence if you want to take action. You are not powerless. If you or someone you know has been affected, you can take action. This industry is a maze. It can be hard to connect the dots and figure out the next best step.